And welcome back everyone, this is Preeti and you're watching Mad Solution. In this video I'll be teaching about the cell injury and difference between the reversible and irreversible cell injury. Whenever there is a stress from the environment, maybe physiological stress or pathological stress, cell undergo adaptations. So each and every cell in our body and every one of us strive to survive. No, even if it is a hard situation, we try to survive. Similar ways, the cell also tries to survive in a many types. It tries to adapt to that condition by so many things like hyperplasia, increase in the number of cells by, and also hypertrophy and atrophy, dysplasia and metaplasia. These are the adaptations which cell adopt in order to bring back the cell into the normal homeostatic condition. But when it fails to undergo these adaptations, even though these adaptations are made, it fails to bring back into homeostasis. Then occurs the cell injury. Cell injury, initially the cell injury occurring will be reversible cell injury. Reversible cell injury means whenever the stress is removed, again it comes back to the normal homeostatic condition. Whenever these reversible cell injuries become severe and then become progressive, then that becomes irreversible cell injury. Irreversible cell injury means there is no reversible back. So death of the cell occurs. Death of the cell occurs maybe necrosis in two types. That may be necrosis or apoptosis. Apoptosis means maybe before the programmed cell death, so it is been programmed. It is similar to the suicide, which we before the planned and then suicide. That thing, murder necrosis is a murder where we don't know about the situation, and these will be the adaptations. If cell fails to adapt, then it will be the necrosis or apoptosis. Cell death will occur. Then now they will discuss about the reversible and irreversible cell injuries differences. Mainly this injury or the cell injury is due to the hypoxia. Most common reason is a hypoxia. Hypo means decrease, like low level. Oxia means oxygen. Low level of oxygen is hypoxia. Reversible, when the stress becomes severe and progressive, then it becomes irreversible cell injury. We'll discuss about the how the cell structure appearance during the reversible cell injury and irreversible cell injury with considering each of and every organelles of the cell. As you can see in this image, the cell membrane becomes swollen and intact. Why this membrane becomes so swollen means the cell will be initially like this, and this becomes swollen like this because sodium potassium ATPase, the channel will be there after cell injury. These channels becomes inactive, and then lots of sodium comes and accumulate inside the cell. Secondary to the sodium accumulation, water also enters inside and becomes swollen. This is a reason for why the cell becomes swollen. And blebs means small, this elevation on the cell membrane, we can see blebs, and this is swollen, and the membrane is still intact. There is no space, like no gaps in between this membrane. Is still intact. Membrane will be intact. In irreversible cell injury, cell membrane ruptures, and then there will be spaces and the fluid inside the cell, that is intercellular fluid, goes out of the cell and becomes shrunken. And these are the changes in the membrane of the cell. And myelin figures, so we can see in both reversible and irreversible cell injury, you can see the myelin figures. These are the myelin figures. You can see myelin figures, but in reversible cell injury, myelin figures will be less, whereas in irreversible cell injury, myelin figures will be more. And mitochondria. When we speak about the mitochondria, in reversible cell injury, all the cell organelles are swollen. So this is also swollen, and amorphous densities we can see in the reversible mitochondria. We can see amorphous density. Amorphous means small like powder, like small densities. And whereas in the irreversible cell injury, this becomes large densities, and calcium densities can be seen. Membrane, we can see blebs, swelling of the membrane, and intercellular particles, and myelin figures we can see in both the condition. But in irreversible cell injury, more myelin figures can be seen. This membrane is disrupted and it becomes shrunken. And about rough endoplasmic reticulum, it becomes a smooth endoplasmic reticulum by dispersion of the ribosomes. Ribosomes detaches from the endoplasmic reticulum and becomes smooth endoplasmic reticulum. This is lysed. This endoplasmic reticulum break down, and then dispersion of ribosomes occurs in both reversible cell injury and irreversible cell injury. And lysosomes are the suicide bags of the cells, as you know. and they destroy the foreign particles by phagocytic action, whereas in reversible cell injury it destroys its own mitochondria. So this condition is called autophagy. Auto means self-phagy, eating, self-eating, like mitochondria it is eating itself. And in irreversible cell injury, these lysosomes swollen and then they ruptures, they become swollen and then ruptures. And cytoskeleton, which maintains the shape of the cell, will be aggregated, and in this case it will be disrupted. Nucleus is clumped and increases a clumped chromatin, so increases nucleus, everything comes closer, and the stain of the nucleus will be increased. Clumped and chromatin stain will be more chromatin, more basophilic it stains, deeply it stains. Whereas in irreversible cell injury, the nucleus completely destroyed. In the first process, that is pink nosis, where there will be clumping of the chromatin and basophilic property will be increased, and karyorrhexis is a fragmentation of the this nucleus, and then karyolysis, where it completely destroying the nucleus. So this is a karyolysis. We'll once again discuss the points. There is two types of cell injury, reversible and irreversible. When reversible cell injury, initially everything will be reversible cell injury. When they consider a person drinking alcohol, initial stage it may lead to the fatty liver. Initial stage, the fatty liver may be reversible by stopping, by asking him to prevent consumption of the alcohol. Whereas if the consumption of the alcohol increases, then it becomes cirrhosis of the liver. During cirrhosis of the liver, it cannot be reversed back. So that becomes irreversible. When stress and stress become progressed, this alcohol is a stress that becomes progressed and becomes severe, then it becomes reversible injury, becomes irreversible cell injury. Cell membrane, this will be intact and this will be ruptured, this will be swollen, this will be shrunken, and blebs can be seen in this, and this no blebs can be seen. Myelin figures are seen in both, but here less myelin figures will be there, here more myelin figures will be there. Mitochondria is all cell organelles are swollen in this. These are swollen. Amorphous densities you can see. Amorphous density swollen and amorphous density you can see here, and the largest, the amorphous density here, large density, and endoplasmic reticulum is dispersed. Rough endoplasmic reticulum becomes a smooth endoplasmic reticulum. This is swollen, here lysis. Both in both the dispersion of ribosomes will occur, and lysosomes, this become autophagy. They eat themselves. Their mitochondria only eat autophage, and they are swollen and ruptured. Cytoskeleton aggregated, disrupted. Nucleus is crumbed and deeply stained basophilic. Here, pycnosis, karyorrhexis, and karyolysis will like pycnosis, and the nucleus become clumped and increased basophilic stain, whereas the karyorrhexis is a fragmentation of the nucleus. Karyolysis is the end of the completely destroying the nucleus, is called karyolysis. This is the difference between